Some healthcare facilities are already taking strain. The grip of the third wave has seen at least one private hospital send home less severe patients with oxygen tanks to create a bed space.
If I look at our bed occupancy, that at least half the beds have now become COVID beds, or at least what we call a PUI or a yellow zone, which is under investigation. So at least half the beds have had to become COVID beds. And again, it's like the one guy said, it's like a concertina. So sometimes you're going to have more COVID beds and sometimes less, depending on how the patient requirements are. But that's really what we're looking at. We're still getting many patients home. And the tragedy, or the real tragedy, is the people who come late, who've neglected symptoms, and we're too late to intervene. And you can see when they come in, you're not going to win in this situation.
Doctors say it's a balancing act between the second and now third wave to manage chronic diseases and emergency COVID-19 patients.
We've tried in the private sector to try and accommodate as many patients as possible. So, for example, in some of the hospitals, they've even treated people in the parking lot in cars with supplemental oxygen on the drip until the bed could be found. That's how drastic the numbers are. So when we look at the number of people, and this is at the moment, we've got at the moment people waiting in cars outside for people in the hospital to be discharged because there's simply no extra beds to be had. So it's really, people have to understand how crucial it is to be careful.
Showing up at the hospital during these tough times is not going to guarantee you a bed space. A central operations centre has been set up where other hospitals, even outside the Netcare group, are asked for available beds. So due to the increasing number of COVID-19 hospitalisations, containers such as these are being used to assess the seriousness of a patient's condition, and then a decision is made on whether to allocate a bed or not. The National Hospital Network, which represents 75 private hospitals across the country in Gauteng, Northern Cape and Free State, are experiencing capacity challenges related to hospital admissions.
The vast majority of our hospitals in Gauteng are on patient divert, meaning that they do not have capacity to admit additional patients, and patients are being diverted to alternative hospitals, both within the private and public sectors. I'm pleased to advise that there are concerted efforts at coordination between both the private hospitals, including with the other three groups, and within the public sector. We are working closely with the provincial departments of health, and in Gauteng we are sharing information on bed capacity.
Medical health professionals are adamant that the faster government rolls out the vaccination program, the more lives can be saved. Chriselda Lewis, SABC News in Johannesburg.